So I think now what we'd go is Dr. Thomas Zeltner, Chairman of the Board for WHO Foundation, has joined online. We will hear him. And then we'll go across the room. I have some speakers online who have joined and hear your views on this very important movement. So Dr. Thomas Zeltner.
Yeah, hello everyone, Dr. Rajendra, welcome, and thank you so much that I can be with you for a few minutes. And first of all, thank you, your team, and all those who are in the room for taking this initiative, because what I can only confirm what Dr. Tedros said, it's time to really get over this digital health divide, and everybody on this planet should have the right to digital health for all. And I think even the ambitious goal of 2028 is something we should try to achieve. Let me just give two backgrounds. I think we often forget a little bit, but they actually are, I think, interesting. First, by now in 2025, actually 2/3 of the world's population, which is 5.5 billion people, have actually a mobile phone. And by having a mobile phone already means you're somehow connected, and you just saw the data from Rajendra on where we have gaps in the internet, and we need to fill that gap. But in principle, we are pretty far. And we know that this behavior and having a chance of even mobile phones is a first step. Of course, apart from geography, we have 2 points we need to look at. A, the access of elderly population, and B, what do we do when it comes to health and use of mobile technology by our young persons who start their life and need to get used to it. Secondly, we need to not forget the demography. Demography in many countries, it's not in 100 years, it's not in 200 years, it starts now that we are lacking a young generation, and we are having a lot of elderly people. So bringing support and even digital support in rural areas should also look into how can we support the lacking healthcare professionals, or the few, that they are able to work appropriately. Finally, and I really like to insist on that, it's always important to remember us, how do we get healthcare reforms right in time? And as you know, many healthcare reforms actually fail. And Harvard was looking into what are the characteristics of healthcare reforms who succeeded. And they are actually 3 elements you have to look into. First, you need a good technical solution. And I think that's what many of you are able to bring to bridge the digital divide, to bring new innovations. But that's not enough. It's not enough to know by 2028 we want to save 2 million people who could be saved if there was a digital support. You need, and that's the second point, you need to address the political process. You need to understand how politics are done, locally and globally. And in that respect, I think that you're on a very, very important path, namely to look in creating a social movement that then helps to bring politics in the countries, but globally, to accept that digital health sans borders is an important thing. And finally, and that's the last and very important message, healthcare reforms can only be successful if you respect the values. If you also enter into a debate about values. And the value we're defending here is health, and digital health is a human right. Digital equity is a human right, and we have to defend that. And we have to fight, I say it openly here, these trends right now that say this country first, US first, other country first, and not to talk about global solidarity. Please keep these three things in mind. You need the technology, you need mastering the political process, and you need to think about the values. And if you do that, I'm convinced, and we need to have success, we will have success. Congratulations. Thank you.
Thank you so much, Dr. Zeltner, and we promise to uphold those values as we move this.